Okay, I would like to call the September 17th Human Services Committee meeting to order. The first item up is the approval of the minutes from August 20th. Do I have a motion to approve the minutes?
So moved.
Second?
Second.
All in favor?
Aye.
Aye.
Okay. Next is privilege of the floor. Do we have anyone here to speak to the privilege of the floor? Anyone for privilege of the floor? Seeing none, we will move to our first proposed resolution, which is to confirm the reappointment to the Chautauqua County Board of Health.
Good evening, Dr. Mike Falk, Chief Medical Officer. I am here on behalf of the county executive to represent to you Dr. Betsy Kidder for reappointment to the Board of Health. Dr. Kidder is a physician and researcher currently working at the Chautauqua Center. She's a George Washington University educated physician, MD, PhD, MPH, with an extensive knowledge in health policy, public health, and is a very wonderful asset to the county's Board of Health. And the county executive has recommended reappointment to the Board of Health. So,
Okay, as a member of the Board of Health myself, I couldn't agree more.
and she currently serves as chair of the board
Right.
since the beginning of '24. So.
She's excellent. So, any questions? Hearing none, all in favor?
Aye.
Definitely well qualified.
The second proposed resolution is to confirm appointments for the Chautauqua Opportunities Board of Directors.
I'm Trish McLennan, Deputy Director with the Departments of Mental Hygiene and Social Services, representing James Feldman today. He asked if I'd come here this evening. This is regarding COIs, Chautauqua Opportunities, and they have 4 names of folks that they have voted on. The way that COI does this, they interview, they talk with people, and then they vote on the people, and then that is brought here for your final approval. So these 4 individuals are folks that have been vetted already by COI and that they are very interested in either continuing or to be on their board, if that's acceptable to this committee.
Do you know if any of these are reappointments or are they all new appointments?
I honestly do not. It says appointments, but I can check for you if you'd like me to.
Any questions?
Most of them are from the North County.
They are, I noticed that
Oh,
too.
I'm not worried about it. I just wanted to make a point of
I
saying
know,
that.
I know, right. Just coincidentally, they are.
Okay, all in favor?
Aye.
Thank you.
Very much.
Thank you.
Third proposed resolution to authorize Office for Aging Services to submit application for Medicare improvements for Patients and Providers Act, MIPA funding on an annual basis.
Yes, good evening, Dana Corwin, Director of the Chautauqua County Office for Aging Services. So this is another annual application that will happen every year. And this rolling approval will give the county executive the ability to sign off every year. It's an expected service that we've provided, for many decades now. And we receive, in 2024, we received $20,000 to do this work, which is outreach to Medicare individuals that are eligible for programs and benefits that reduce the cost of Medicare to them, particularly Medicare Part B and Part D. And in this year, we received $29,000. So every year we have a rolling application for this, and the resolution is intended to take care of that application every year.
Do those applicants have to qualify financially?
They do. It's financially dependent, but it is an enormous assistance to those that are low income
Sure.
to have to pay that Medicare Part B and Part D plans. So it's a
Yes.
wonderful asset for our county.
As a new participant in Medicare Part B, I agree.
Yes.
So this would be giving the county executive permission
to do the annual application every year
Every
without
year
coming forward
in-
with a resolution every
into the
year.
indefinite future.
Mhm.
Any questions, concerns?
You said it was around $24,000?
It was 20,000 in 2024, and in 2025, we received $29,967 to do that work.
Pretty good increase.
Not bad, considering.
Do you know how
Has the
many,
work increased, or is it,
The work is always increasing, considering we have a ballooning population of baby boomers coming to the age of 65.
hopefully they'll continue to recognize that and keep giving you more?
Mm-hmm.
Is it, do they pay you based on numbers that you're?
Census.
Yeah, so,
I'm not sure of the exact formula and how it parlays across the state of New York, but there is a formula that's more than likely has to do with census and aging population.
Okay.
So,
so forgive me, you may have said this, but
That's okay.
this money you use for staff, or does this money directly go to the recipient?
it doesn't go to the individuals, it's staff's performance through our New York Connects program and our HICAP program, which is Health Insurance Counseling Assistance Program, to do outreach into the community to let people know about this.
Okay,
I think the lowest Part B premium is somewhere around $112 now. The highest is close to $200. So you can imagine somebody that wouldn't know about this, having a lower income, how financially important this would be.
yeah. 112, I thought it was 160. Do you know how many people it helps, the program
I
itself?
can go back and look from last year, but I didn't bring those numbers with me
It's
tonight.
just curiosity more than anything, I mean.
And again, that money that we receive under MIPA is to do the outreach work.
Yeah,
So for
right.
instance, we have a Medicare 101 coming up. We have different things that we put out to the community to try to let them know that this is a possibility. And our New York Connect staff evaluates every caller that calls. That's Medicare age or coming to Medicare age, so that we can let them know about these different programs that could be available to them.
Okay. And I appreciate you sending out that information regarding the Aging Expo.
Oh, no problem, thank you. I had to figure out exactly the email group to send it to, but I got some help.
Okay, do you have any questions? More questions on this, concerns?
No.
Okay, all in favor?
Aye.
Aye.
Thank you.
Thank you. Okay, now we have some late resolutions in, under the other category. Late resolution to authorize the Chautauqua County Department of Mental Hygiene to provide clinical supervision and/or mental health-related trainings to Chautauqua County Public Schools. Do we have anyone here to speak to that?
Hello again, Trish McClendon, Deputy Director with Departments of Mental Hygiene and Social Services. We're bringing this to you more as risk management. There's no money exchange in this. What happens with folks who become licensed social workers or licensed counselors, they need, if you're not aware of it, a level of supervision ongoing in order to get their license. Rachel Ludwig, one of our licensed clinical social workers, been with the county for quite a long time, over 20 years, already provides that a lot within our county clinics, as do some other LCSWs. Many of the schools, some schools have our therapists in them. Some schools have not elected to use our therapists, which is fine. They have their own, they've hired their own, but they also often don't have a system in which they can supervise their own staff. So what we've often done is help a little bit with supervision. In addition to that, as you've heard me talk about before, we're in schools for different reasons. Some schools want us to come in and, like I've said, provide a therapist, which you've approved in the past for different schools. Other schools need specialized mental health training, prevention training, substance use training, and we do that either for students or for the teachers. What this resolution is, and what we're suggested to do, is to bring it through as a resolution to approve as a whole any of the schools that wish to have it and that we are able to assist with it in our county to be able to provide either supervision, again, it's not everybody, but if it's an appropriate relationship, where the superintendent's on board with it, it's appropriate for the clinician at that school, it's appropriate for our staff, and then also trainings. It may be suicide prevention training, mental health training. We do some wellness training every year at Westfield School, which they like us to come every single year. So this allows us to do this. This is not a resolution for those therapists that we put in the school that we end up as part of our clinic, as an off-site that we bill for. So there's no money exchange in this. It is just to say, is this something this committee is okay with us proceeding with to continue to have relationships with schools within our community to help support them in ways that they can't always support? If that makes sense.
It does. Any questions? I'm sure there are.
I do, sure. I was able to serve on a school board for a while.
Good.
And I think it's important that, schools sometimes provide services that can be challenging for a district to provide. Schools are there to educate our kids and to do certain things, and then now they're providing some mental health things, and they're not sometimes best equipped for that, and the supervision thing is difficult. So you guys are in the business of mental health, and you're more apt to be able to provide that supervision or help when needed. So I think this is a great opportunity and is needed in the districts. And some of the districts really see that, their district would benefit from having an in-house person, and I don't disagree with that, but I think the supervision part is tricky for them. And so this really opens up the avenue to really help bridge that gap. And it does, quite honestly, we don't have enough people to put in every school either, so
You're correct.
and that's why schools started putting people their own,
Mhm.
but they do need a little help, so I think this is really great. And, at the end of the day, we just really need the service there, so, and there correctly, so.
I agree. Thank you very much.
I'd like to echo Dan's feelings on that. I think it's probably a very worthwhile and needed program. I have a couple technical questions. Are schools required to provide this service by state? Or
They're
by-
required to provide a type of counseling. It's not necessarily required to hire a licensed therapist. So you may see, like at the IEP, they're required for certain kinds of responses. Some schools, like Mr. Pavlik has indicated, prefer to keep it internal. Some, just down the street, Chautauqua Lake Central, they have one of our folks in 2 days a week. And we're in about 8 other schools. We actually are a county that is on the high end of actually supporting our schools and doing it this way. Many counties are saying they just don't have the counselors. To be honest, Carmela's and my approach is I'd rather see kids receive counseling services where it's best. I mean, sending them to a clinic is not always the best place for a kid. So that's why we also, and you saw this recently, we're licensed at Southern Tier Peds. We have a clinic there, we have an offsite. So we have a staff there full-time over there. So you've got physicians and parents who can actually have their kids seen for the doctor's appointment and our counselor. So, and it's okay if they don't do it that way, though. Some schools prefer to have their own, and it works out beautifully, beautifully. So it can be either way, but the trainings also is the other piece. Through the Tapestry grant that you folks heard about from Rachel a few months ago, that has allowed us to provide, free of charge, a number of mental health-related trainings for both staff and students. And that's been something that, of course, you would never expect a school to do that. They don't, it's hard. So that's something, we do partner well with these folks, we partner well with the superintendents, and we want to continue it. We consider that to be part of our mission, to be honest, is see people where they need to be seen, not always at a clinic.
So we currently do
We
this.
do a lot, yes, and we realized as we wanted to more formally do some supervision. We haven't formally done that level of supervising the staff, signing off on their supervision. We're very much the contract to the MOU would be having with anybody who does that would indicate very clearly there's no responsibility on the county's end. We're not responsible for the care of the kids. The school is, that therapist is, but we're doing professional supervision. It's not uncommon to do that.
So are we
Okay.
expanding them or just?
No, we're not
formalize it,
growing, no,
just
we're not
formalize
growing.
it.
We're not growing. We are doing, that relationship role is a little different. We already do that internally. For example, a social services staff may be working on their MSW. They need a clinical supervisor. The supervisors in social services are not licensed social workers, they're not supposed to be. So you'll find someone like Rachel Ludwig who will say, yes, I'll take this on in the county. And the person will come up, meet with her, they do it during work hours, and that's a very different relationship. You don't need a resolution for that. That's a working with each other and also part of one department. This would be something a little different, as needed, carefully thought out, very reviewed, but it allows, as we all keep hearing about workforce shortages, it allows people to get their supervision, not have to leave a school to go to another site to get licensed, and actually stay where they belong. We want to support the schools with having what they determine is important, not our staff always. So if they need that, if they've got several staff on board who are therapists, and one of them's licensed, that's a person who will do it. But some of your smaller schools don't have that, they just have one counselor. So that's that kind of situation, but it's not every school. Okay, just so you know that part,
Okay,
if that helps any.
okay. Any other questions?
Yeah, what if, when they designate a student definitely has some mental issues, where does it go from there? Because you hear about it all the time. Guns don't kill people, people with mental illness kill people. So what happens when they definitely know that there's a child here that has some issues?
Okay,
Where does
okay.
it go?
It can, if it's more than what a school can manage in-house, because the therapists in-house, they're not part of a licensed clinic, okay? So we are licensed by the New York State Office of Mental Health, okay? So we have to meet certain regulations. So often it's referral to someone with our clinic. If we've got a therapist in that school, they can see that person. If they need to see a provider, a nurse, psychiatric nurse practitioner, a psychiatrist, we can either do it through telehealth or in person. If you
Parents
really are
involved-
talking the
involved in
guns
all
thing,
this too?
pardon?
The parents are involved in all this too?
We can, yes, oh, absolutely, absolutely. If you're talking the guns, we now have, this is the sheriff's program, and it's wonderful. We actually are being recognized in the state as having one of the few counties that's doing it as well. ShawTAC, have you folks heard about that yet? The Threat Assessment Management Team? Amazing. Well enough that right now we have a relationship with UPMC Chautauqua where if they're identifying, and they have a new regulation, anyone with an increased risk, elevated risk for violence with behavioral health, they have to reach out to Carmella or myself. If it's looking like this person might really be a risk for literally killing someone, whether it be a kid in a school, whether it be an adult, this can get referred to ShawTAC. And Phil Lombardo, hats off to him, he's doing an amazing job leading that, just amazing. To the point that New York State Office of Mental Health asked me for permission to send 2 of their staff down just to sit in a meeting so they could take some notes. We did that a few weeks ago. They're going back to their offices, and ShawTAC may be asked to go talk to some other counties. So kudos to Chautauqua County and to our Sheriff's Department for that, really.
Glad to hear that.
Great work happening.
And this is open to all ages. not just the
Absolutely.
counseling.
Absolutely,
From
100%.
Tiny
Yep,
to,
you
for
got it.
anything, a tragedy, a parent dies or something. and
Yes.
They need
Yes.
grief counseling.
And we do that too, by the way. We do go out, and I'm just gonna be careful, this is recorded, I'm being sensitive, we're in a small county. But we do, if there's a occurrence in a school or a location or something else where there's a large tragedy, we will often get a call to ask if we can support. We do that too. We did that very recently to an area, and that we'll always do. We have staff trained for that.
Okay, any other questions? All in favor?
Aye.
Thank you very much.
Thank you.
Thank you.
Okay, another late resolution to amend the Chautauqua County Department of Mental Hygiene and Social Services 2025 budget for increased safety net costs. We got an extra chair coming. so-
Yes.
Good.
This is the resolution that has a typo in it.
Okay, yes.
The total of the accounts is not accurate. The total should be 1,150,000 instead of 800,000.
Okay, so we'll treat that as a typo. Okay, everybody got that? Does everybody need time to read this? Since You just received it?
Yep.
You need that?
No.
Oh, okay.
I wish it wasn't around.
Well, that's why I asked if you.
We can come back next month if you want.
Not gonna change
No.
for the better? Okay, take it away.
Blake Eric, Director of Administrative Services.
Carmelo Hernandez, Commissioner of Mental Hygiene and Social Services.
Diana Songer, Deputy Director of Finance for Human Services.
So this resolution before you is the request to amend the 2025 budget to increase the contractuals for safety net of 3.5 million, while increasing the use of fund balance by 2.385 million. Obviously, we've been monitoring SafeNet all year. We have seen an increase as of end of August. We're averaging about $1 million of expenses each month. And this year, in 2025, we budgeted only $8 million. So we're hopeful that this would get us to year end. But obviously, as we all know, safety net is hard to predict. And with the current trends, we're hopeful that we don't have to come back before year end, but that is obviously subject to change.
We already did this once this year already.
No, this is the first
We
one.
did, not this, okay.
This is the
It was
first one.
End of last year.
Yes,
Would be-
yep.
Any questions?
I have a comment.
Okay.
So, I'd just like to just reiterate our thoughts when we are coming up with a budget, and we knew $8 million during budget season was marginal and probably not enough.
Mhm.
But, we realized that we had a fund balance, that we would be able to make up the difference of probably around 3-4 million is what we
Mhm.
anticipated. So I just want to reiterate the importance of that fund balance so that we can utilize it for this, and that we can make up these differences, whatever that would be. And the difference of making up that, we realizing what it was during budget season, if we had increased that budget line from 8 million to say 12 million, it was a pretty hard hit to the, tax cap, and also our, local share that would, have hurt everybody's, taxes. And so we elected to utilize the fund balance for this at a later date. It's important to have that fund balance. Now, if we hadn't used it, that'd have been great, but it
Mhm.
was kind of an anticipated use. And so when we take some backlash about having a bit of a fund balance, it's needed, because this is probably one of many budget adjustments that we'll have to make throughout the year. Did you expect it to have any other large adjustments this year from the department?
Oh, no, not at all. And I could give you some of the data here. So we saw the numbers increase from anywhere between, I would say, April to August, and then it started, not right now it's plateauing, but at any point in time, it could go back up. So I'll give you some of the data right here. Placements, they may be in shelters and a hotel. Each month, the department receives a little over 100 applications for eligibility determinations. And that's not including the 200 that we are already serving. And just to put things into a little bit of context as well, our Family Center Case Management Team, they started in April. We received what's called a PASS, which is basically a waiver from the Office of Temporary Disability Assistance to be able to meet market value rent. We haven't been able to find a lot of suitable homes, but we've been able to prevent evictions to prevent people from falling into the safety net. And we've been able to save the county from April to present date, local share savings of $138,376 with that program. Now, I know that doesn't compare to the number that we're asking for, but hopefully programs like these and having that waiver could help us chip away at it and put us at homeostasis.
So looking forward to next year's budget. Any thoughts on that?
Yeah, we are planning on increasing 2026 budget.
couple weeks.
And my question also was there any other department-wide? So, I know we have other areas that have experienced some overtures and things, but, throughout the whole department, do you expect to have any other big overages?
This is the biggest one.
Okay.
Yeah, the only other thing I'm thinking of, because of the vacancy savings that was in 2025's budget, I think DSS is in 6010, we might not be seeing that 5%, it might be a little less than that, so there might be some overage in the .1s and .8s there, but yeah, so there might be a little bit of overage there, but yeah, I mean, like Carmelo said, safety net is by far the biggest, so.
Yeah, and the other one we were having a little difficulty with were the fees that we were having to have people up in Buffalo for detention, and that seems to have kind of come in where we expected, so that's helpful.
The 730s, yes.
Yeah, 730s.
So you already know 26 budget's gonna be bigger than 25 budget because of these amendments, when we have a budget review?
Yes, we are planning on increasing safety net's budget, yes.
Anything else? All in favor? Aye.
Thank you.
Thank you. We have one more late resolution. Just put on your desks if you need more time. Authorizing and approving settlement agreement and action relating to the opioid crisis, Purdue Pharma LP, and the Sackler family.
Hi, Nathan Harp, Assistant County Attorney. I can say a few words about this. This is something that the County Attorney's Office actually received from our council yesterday morning, hence the quick turnaround, and a response is due on September 30th. This is in relation to the settlement of a long ongoing web of litigation involving the Sackler family and Purdue Pharma. This has been very complex and has happened at very high levels of government and litigation. There was a previous agreement which was actually struck down by the Supreme Court of the United States last year. This is the result of a renegotiated settlement involving the attorneys general of all 50 states. I think collectively the amount is $7.4 billion. That said, New York gets a piece of that, and then New York is sharing, its piece with its, the state government and then various municipalities. All that to say, it's a very complicated, there's a lot of moving parts. And so that's why there's not an amount in this resolution. That's not really information that we've received from council or that we frankly have yet. What I can tell you is that our attorneys our outside counsel that we've retained has obviously reviewed this in great detail and recommends that we accept, the settlement that's on offer. The county attorney, Anna Morgan, has done the same, and she sees no reason why we should disagree with our council's recommendation.
Okay. And if we don't get in it, we go on our own.
Yeah, I don't want to speculate too much, but I imagine it'd be quite a mess.
Yeah, exactly. So, any questions?
Yeah, how long do you think this will get dragged out before it actually sees some money?
It's tough to say. Based on some of the information I've seen, for the Sackler family, out of the $6.5 billion that they're paying, I think $1.5 billion is supposed to be paid within the first year or so. I think it's a different question as to how soon we would be receiving any of those funds. I imagine it'd be quite a while longer, but that's just speculating.
I have one question. It seems like we get things frequently that need to be turned around like, immediately. And it's challenging. You know, what if you missed this by a couple of days, even, or you got this and you needed it by the September 30th? You know, it's a shame that there isn't a better system for that, so that way we're not in the later emergency resolution situation, you know, and it seems like it happens quite often, so, you know, I just, you'd think that the agencies or places that are putting these things out would realize it takes government a month or two to react sometimes, or to be able to get it approved, you know? So, whatever pushback we can ever have in that category is I'll push it towards you to say, look, we need a month to have this and have it in place in that, you know? I think our legislators are always very accommodating for these things, because we want it, you know, we understand the urgency, but it also puts a strain on it sometimes too.
I can't imagine other counties maybe already had their meeting and it's passed.
Yeah,
You know,
that's right.
I mean, we're thinking just us, but there's other,
You know, and that's just it, you know, other places, do they have to have now a special meeting if they've already had their meeting to get this in there, you know, too, so it's challenging.
Yeah, I completely understand all that. I mean, full transparency, I started with the office this week, so I'm just kind of coming into this situation myself. Yeah,
Jim, hot seat.
I shouldn't, you know, I don't want to guess as to the cause of, you know, the quick turnaround. I don't know if we're just kind of subject to the overall framework of how this is happening, and there's bankruptcies involved, and there's all sorts of, you know, legal timelines.
You weren't here 2 weeks ago to bring it to us, that's what the old.
Yeah, that's, yeah, there you go.
cheerful.
Should have been here 2 weeks ago, I probably.
Okay, anything else?
Yeah, I just want to make one comment. The saddest part about this entire resolution coming before us is that nobody stopped the addiction from happening. Nowadays, if they think something's even mildly addictive, they put warnings out, they watch your prescription, they monitor your care down to like a microscopic level. And then all the people that, I'm sure everybody knows a person or two whose life changed dramatically for the worst based on an opioid addiction, whether it was from a car accident or a medical problem or who knows what other reasons. There are more out there, but that's the saddest part about this resolution tonight. Thank you.
Okay. Anything else? All in favor?
Aye.
Okay, is there any other? Seeing none, I would take a motion to
I'll
adjourn.
make a motion to adjourn.
Second?
Second.
All in favor?
Aye.
We are adjourned.